Hi, I'm Keith Banner, and I'm with the Ohio Department of Developmental Disabilities. I'm a Community Life Engagement Project Manager in the Division of Policy and Strategic Direction. And basically, I'm going to walk us through kind of an overview of the Ohio Department of Developmental Disabilities and the concept of community integration and employment first. So, welcome. Basically, the mission of the Ohio Department of Developmental Disabilities is committed to improving the quality of life for Ohioans with developmental disabilities and their families. And then we offer support across the lifespan of people with developmental disabilities. We oversee a statewide system of supported services that focus on ensuring health and safety, supporting access to community participation, and increasing opportunities for meaningful employment. Those last two concepts, community participation, integration, and employment, are kind of my primary focus. So we'll be talking a lot about them. Nearly 96,000 Ohioans access services by working with the county board that they live in, Boards of Developmental Disabilities, or 88. We oversee and support that network of 88 county boards, direct service providers, and provider agencies, all in kind of focused on supporting people to live, work, and thrive in their communities. So community integration is kind of the whole focus of this talk. And I usually start with this meme, which is through openfuturelearning.org. It's a great organization. If you get a chance, check that out. But this meme is I want a life, not a service. And it kind of cuts to the chase on explaining the whole situation around community integration and people with developmental disabilities. Historically, oftentimes people with developmental disabilities were segregated or isolated from the rest of the world, rest of the community, and in special schools and facilities, institutions. This was kind of the most of the 20th century, but now and in the last couple of few decades, the idea is to help people with developmental disabilities desegregate, de-isolate, become a part of the world that they live in, become a part of the community and contribute to it, and have lives kind of like the lives of anybody else, only with the supports provided that help them do that. So community integration is basically the way people would like to live, and then how do we provide supports to make that happen. So noun, right? Community is a noun, a feeling of fellowship with others as a result of sharing common attitudes, interests, and goals. And integration is an act of, or an instance of combining into a whole. And that's the whole idea is how do we help people who have historically been left out get back into the fold, become a part of the world the way anybody else is a part of the world. And that means access to friendships, access to exploring interests, access to developing an identity that goes beyond just service, but into who you are as a person and who you want to be with in the who have shared interests and who you want to have fellowship with. So you got to do this, you got to do a little empathy exercise. You got to think about how you yourself live, work, play, contribute, worship, develop relationships, connect, do what you want to do, as well as what you have to do in the community. Make a list in your head, right, of all the things that you do to continue living in the community and exploring interests, doing what you want to do. That's kind of the concept we want to have when we're sitting down to plan supports for people with developmental disabilities. You got to think about what's on that list. How do all those activities and interests you have help define you? They're your identity in a lot of ways, and also help you connect with other people. What's your story? So you're going to a party and you're saying you have one of those "Hello, my name is," and and you're explaining who you are. You often don't lead with who I am is going to the dentist, who I am is going to the doctor. You lead with probably what you do for a job, what your career is, who your family is, what your interests are, so that you can make a connection with other people based on those interests. People with developmental disabilities have often, the lead in their lives has been the services they receive, the institutions they live in, the day programs they went to or go to. So how do you reshape and reform a system so that the system is responsive not to services only, but to what services can result in, which would mean exploring interests, getting a job, living in the community like everybody else, but with supports that help you do that. This concept of trying to figure out what people are interested in and connecting them to other people that have the same interests is kind of keyed in on this idea of social role valorization, which means valued social roles and the positive status that go with them are a key to obtaining cultural collateral benefits inherent in any given culture. So when you think about all the activities you do, right? If you make art, you're an artist. If you if you do any activity, there's an identity that's related to it, and other people share in that identity, and that social role becomes like a way to kind of introduce yourself to the world and kind of fit into it. So the supports that DODD, the Ohio Department of Developmental Disabilities, authorizes and helps provide should help people connect in the same way all of us connect, and should also help in establishing those valued social roles authentically, with an emphasis on helping to make good things happen, as well as paying attention to the meaning of what we're doing and trying to accomplish, in order to increase the likelihood that people won't be segregated and isolated, and that they'll have access to opportunities like anybody else has access to opportunities. And that's the way we're going to justify the funding, which is the funding aspect of all this is usually through Medicaid, which is a federal program that we partner with to pay for supports to help people live, work, and thrive in their communities. And those good things that we're trying to make happen include a job, relationships with people with and without disabilities who share similar interests and ambitions, learning, growing, accomplishing the goals that people want to accomplish. Historically, too, the direct support professionals, people who are actually, like in this picture, helping people live, work, and thrive, their identities have been often as caretakers or seen as caretakers, that they're there to support people with, maintaining their health and safety. But with this idea of community integration, that role, that identity opens up to be more about not just helping somebody stay healthy and safe, but trying to help them explore and understand the world around them, and how can they make connections. So not only are you a caretaker, but you're also almost like a gateway to supporting, to finding other people who might share an interest in the same interests and ideas and values that the person you're supporting does. So that opens up the job so that you become more about hanging out with intention. It's an acronym that we use, HOWIE, that's really basically just about supporting people to be more integrated, is often about just hanging out with them and intentionally trying to figure out what inspires them, and also taking notes and figuring out what their interests, talents, and skills are, so that we can help match them up with people outside of where the service is being delivered, out in the community, to see what we can make happen and how we can kind of help people be less isolated. And that means you're going to try to get to know the community in a different way. You're not kind of pulling away from the community, but you're helping people enter it. And you're going to start mapping out the community for opportunities that might be there based on those shared interests, based on those ambitions that you're trying to figure out as just day in and day out hanging out with somebody. So community integration is more than being physically located in the community. It's more than a schedule of activities. It's more than just fun and recreation. It involves active participation and membership. It's connecting with other people, having that valued role we've talked about, trying to make a contribution or helping people make a contribution. So with this concept, people that we're supporting are empowered to decide and control their own futures. It kind of stresses what people can do rather than what they can't, places an emphasis on experiences. All people can learn and contribute is an assumption that we go with, supports people to follow their own interest, and success and accomplishment looks different for each person, because each person is their own human being, and they have their own sense of what they want to make happen for themselves. So key to a lot of this, like it's key to anybody's life, is having a job and having an income and being able to explore an interest that allows you to contribute and make an income. And community employment and community integration are kind of totally related. And the concept of employment first, which I'm going to go into here in a little bit, kind of works to ensure that all the people that we support that are, of working age have the opportunity to do that. Historically, people with developmental disabilities who wanted to work were often kind of put into or asked or the programs, that the supports that were available to them were in sheltered workshops. So they would often end up with other people with developmental disabilities in workshops where they oftentimes would get sub-minimum wages to do the work. And now that idea, and historically that's that isolation, that's that segregation. Now the idea is to help each person figure out what they're good at and what they're interested in, and then use the supports to access actual jobs, just like anybody else. So we call this competitive integrated employment, and it's part-time or full-time work in a integrated setting, which means in a place where people with and without disabilities go to work together, where you're compensated, eligible for benefits, and presented with advancement opportunities, not based on your disability, but just like anybody else who has a job. We want to use the supports that we're paying for to make that happen, as opposed to use the supports to make a facility or a sheltered workshop happen. And so that's our vision. It's working age adults working, and to achieve this, having an array of supports that help people get jobs, keep them, get better ones, get more money, have more meaningful lives, have more social and economic independence. And so we also know that there are times when people won't or don't work, or they retire, get sick, get fired, quit, have setbacks, and even times when the people supporting them, we can't figure out what that job might be. So we want to have services and supports available during those times to help people understand options, discover ways to contribute, connect, participate meaningfully in their communities. It's a service system that provides momentum, helps people figure out the pace of that trajectory they're on to make things happen, the things that they want to happen. So many forces in Ohio kind of have helped us kind of figure out we need to be on a more community-based, community integrative path to supporting people with developmental disabilities. The Center for Medicaid and Medicare Services, CMS is the acronym, kind of came into states a decade ago, Ohio included. Medicaid is the main funding stream for a lot of the supports I'm talking about, and they're called Medicaid waivers, home and community-based services waivers. And in Ohio and other states, CMS a decade ago came in and kind of looked at the way that the waivers were being accessed and used and what they were paying for. And they kind of said, time out, we need to understand that the Medicaid's waiver was intended to help people be desegregated, deinstitutionalized, and a lot of times the money in many states was being used to keep facilities and institutions going. So basically, that CMS came out with some rules around settings that told us in Ohio and in other states that we need to have a response to that CMS ruling and that CMS kind of audit. And from that, in the last 10 years, 12 years, we've been kind of trying to figure out this community integration piece, because Ohio, like many other states, has a large proportion of day program and pre-employment supports that are provided through facility-based entities like sheltered workshops. So inherent in all this change to community mindedness, we have to also think about the providers that do the services and how they need to transform from facility to community-based supports. And that would require leadership, systematic internal shifts. So it's this big, huge, complicated organizational issue that we're dealing with. And one way we've dealt with that is through establishing in 2012 Ohio Employment First, which is community employment is the first and preferred option for all people with developmental disabilities. So employment first, every person, every talent, every opportunity, that tagline really gets at it. It's like each person has talents, and that will yield hopefully to opportunities they can take advantage of to be employed in the way they want to be employed. So employment first is a concept, is a philosophy. It's not a program plan or even a service. It's just a way to organize the services, right? So all people with developmental disabilities are presumed capable of, that competitive integrative employment in the way that they want to do it, right? So we want to make sure that that option is first, especially, for all working age adults and for transition age youth. So from employment first, this concept, that was signed into an executive order by Governor Kasich in 2012, came an Employment First Task Force that basically aligned all the policies and all the departments that have anything to do with people with disabilities to have the same language, the same policies to help people, again, have their first option would be to have a job in the community. And those organizations include us, Ohio Department of Developmental Disabilities. We kind of drive the agenda for the task force, and then also the Ohio Department of Education, the Opportunities for Ohioans with Disabilities, which is the vocational rehabilitation state agency, which is every state has one that helps people with disabilities access community employment, any kind of disability, not just developmental. And then Ohio Department of Mental Health and Addiction Services, the Ohio Department of Job and Family Services, and then the Office of Medicaid Services. They meet monthly at a task force meeting and compare, contrast, and align policies and procedures to make sure that employment is the first option for people with disabilities. Also from that Centers for Medicaid, Medicare systems kind of oversight came this idea of what our priorities are in Ohio. And it's person-centered planning, membership in the community, and employment. Those are the priorities we want to make sure, and that was reflected up top when I was giving you the mission of DODD. But basically, person-centered planning is this concept that you come together with the person you're supporting, family, friends, providers, anybody else that has a vested interest in that person, and you just plot out what the person wants to achieve. Then you back out of that vision into here's what's available to make that happen services wise, and what do they need to make that happen. You think about that and you plan out in a person-centered way the way that the supports are going to be aligned to make those outcomes happen. Get a job, find other people who are interested in art, whatever we're talking about. Those outcomes are going to drive the services. Before a lot of this idea of community integration came through, oftentimes we just had like a meeting where you said, oh, you're gonna go to this program and that's the outcome. You're gonna go to a building and you're gonna be in a program. And the results of all that activity and all that energy weren't really considered in the mix. Now, when you have a community-minded kind of sensibility of the way that things are organized and delivered, you're going to start thinking about what can people accomplish and what do they want to accomplish with these supports. So that person-centered planning drives community membership and community employment, and we align those supports from the waiver that I mentioned, the Medicaid waiver that pays for people to help people in their homes, people to be in the community in day programs and other kinds of supports. How are we going to use all that energy and all that funding to make something happen around community membership and around community employment? So that's basically, like I was just saying, all the priorities around person-centered planning. There's a requirement now for a person-centered planning, which is developed through an individual service plan, the employment first information I mentioned, and then community. We've established standards to ensure that home and community-based services waivers, those waivers I talked about through Medicaid administered by us, maximize opportunities for folks to access the benefits of community living. So from all those priorities comes this concept that it's individualized, it's person-centered. If you were in my neck of the woods, you'd hear these concepts kind of always going on, like person-centered, individualized services, that individual at the center, kind of reaping the rewards of what a community-focused kind of set of supports and planning would help with. That would include stronger connections, developing abilities, expanding natural supports. Natural supports are basically is people who aren't paid to be with somebody, wanting to be with somebody based on shared interest or just, because they're friends. So expand that network, increase self-esteem, enhance quality of life, improved health. All those benefits are aligned around this idea that the more somebody is pursuing what their interests are, pursuing a better job, pursuing interests, and sharing those interests with other people and those contributions they can make, that's the assumption that they're going to have a better life. And that means this framework of person-centered planning means, like what I was talking about before, we're going to try to figure out a result. We're going to try to make something happen, and that's an outcome. It's in system speak, but basically it's just we want to get together with the person, figure out what they're wanting to accomplish, set the services in motion, and have an agency neutral idea around that, which is all those agencies I mentioned that are in part of the Employment First Task Force, or all the services that somebody has access to. We want to make sure that they're used in that same pursuit. So we go agency neutral because we just want to think of the supports being aligned to make things happen, not just to keep programs alive, but to have each person have a life. Also in this concept of moving forward and using supports and trying to figure out the best way to use them, from the Employment First initiative comes a concept called the place on the path to community employment. And this is a way to begin the conversation with transitioning youth, kids that are coming out of school, or somebody who's been in a sheltered workshop a long time, or who's never had even an idea what a job is you start the conversation by saying, what place do you think you're on in this path? And there are four. One is, I have a job but would like to have a better one. Two is, I want a job, I need to find one, and help to find one. Three is, I'm not so sure about work, I need help to learn more. And then four is, I don't think I want to work, but I may not know enough about it. So that those places on the path to community employment kind of help define and begin the conversation around, well, what do we want to do to help you move forward? And also a part of this whole concept is what I do, which is I'm a regional community life engagement project manager, and basically there are five of us. I'm down here in Southwest Ohio. My role is to kind of help the system move toward all the stuff I'm talking about. So basically, we're trying to take this concept of employment first and community membership and implement it in a system that historically hasn't really been nuanced and able and had the dexterity to make those moves. So we're trying to help providers, families, schools, individuals, people we support, the community at large, kind of have a more nuanced understanding of how people with developmental disabilities are just like us. They just like anybody else. They just need some help sometimes to get to where they want to get to. And so a lot of the work that I do is around helping providers kind of reconfigure how they do business, helping schools reconfigure how they plan for transition, because oftentimes back in the day, historically, kids coming out of high school with developmental disabilities often were tracked into facilities, into programs. Now you're trying to help all these players, all these stakeholders kind of get away from this concept of just a building and that's where you go, to how do you use that funding and that energy and that endeavor, all those endeavors to help make something happen for each person. And so my main responsibilities are expanding regional strengths and innovative approaches, removing barriers if I can, ensuring that we integrate and coordinate with other organizations, and just establish goals in the region around working in partnership to make some of this community integration happen. Key to that, like I mentioned, is this idea of provider transformation. We have a huge amount of large, small, medium-sized providers in each part of Ohio, in each county, that does all this work I'm talking about. So we have a kind of a provider transformation kind of way of kind of approaching the work, where we help folks assess what their programs and supports are doing and what the actual results are. And then we create a plan based on that assessment. Then we implement the plan, and then we continually evaluate. And then innovation happens because we're being self-conscious about what we're actually in business to do, which is help each person we support accomplish what they want to accomplish. And so that innovation occurs when providers, organizations assess, plan, implement, and evaluate. And there's 7 main goals we kind of go with. One is leadership needs to have an understanding of what community life engagement, what community integration actually is, and what it means for the people they support. And then you need to establish goals and strategies and operating policies that push forward community life engagement and employment. And then you look at the way you are financing all the activities you're doing, and emphasizing, now that you've kind of assessed and have an idea of what you want to accomplish around helping each person achieve what they want to achieve, then you start figuring out how to finance that and how to possibly diversify your revenue streams, how to reach out and figure out new ways of making some of this happen. And then you're going to obviously need training and technical assistance to do those maneuvers. And then you're going to probably, well, not probably, you will start collaborating once you understand the concept around community integration. You're going to make partnerships with businesses, with other organizations, with all kinds of different community organizations you never really thought about or pulled into your fold before. So you'll need to have an interagency collaboration and partnership kind of mindscape. And then again, all of this is in service to this idea that services and supports are constantly innovative as you, as organizations reach new goals, new strategies, new outcomes. And the way you do that is through measuring what you're doing, establishing what you're trying to do, and then measuring what you're doing. Because without that measurement, without that examination and evaluation, you don't really know where you're going. Case in point is an adult day provider here in Southwest Ohio wanted to figure this out. And we worked together first on getting a clear picture of how they currently operate, how they bill for the work they're doing, and how they staff it. And then we talked about leadership management, how that was handled. So by the end of this process of just kind of being self-conscious about what you actually are on earth to do as an organization, we got had a pretty solid program support assessment to move toward planning. And then we talked about how they see that organization that they're in 5 years. What would it look, feel like? How would it be different from today? And what help would they need to make that change? And we also talked about the people they're supporting. Was anybody really interested in getting a job and or having more connections? And so the CEO and program director said yes, they could think of a couple of people, maybe 4, to start that, to try that. And so we came up with a real simple plan that would support a pilot project. They would support 3 people to get jobs and connect more meaningfully in their communities, and they would need to diversify their services and look into certifications beyond the services they're currently delivering. We talked about reaching out to individuals, families. SSAs or case managers are the people who draft and author the plans and kind of monitor to make sure that they're implemented. So we'd pull them in and other supporters in order to set up meetings to look into how to get started. So you start with a bigger concept, but when you bring it back down to earth, it's basically you're going to start supporting people who you've probably supported years and years in a segregated facility. You're going to try to branch out of that segregation in that facility into person-centered planning and person-centered supports, with an idea that each person has a goal, has a reason that they're using the service, and a result they want. Again, around this whole idea of transformation can kind of be keyed in on as in the way that kids coming out of school transition into adulthood. And we have now, through Employment First, a transition vision plan, which is that CIE, that competitive integrated employment, is the expectation for all youth with disabilities. Transition planning requires multi-agency, agency-neutral planning, like I talked about. Every dialogue with families and individuals is critical to ensuring an employment outcome. There are multiple pathways to employment, like I mentioned. And excuse me, person-centered planning is key to the development of services and supports. So all of this information, all this energy is aligning across all domains of a person's life: school, adulthood. All of it's kind of coming together around this same concept of the reason we're all here together to plan and authorize these supports is to help somebody get a job, become a member of their community, be in the community, not in a program. So the purpose of the Employment First Transition Framework is to assist youth to achieve employment and membership in the community. And that framework includes state, regional, county, and individual levels of strategic action steps. Resulting practices lead to individualized goals, transition planning, and access to meaningful transition services. And this walks us through that framework of individual, regional, county, and state level activity on this slide. All of this evidence-based practices and predictors. Back in the day, we really didn't have this. Now we have evidence that if kids in school have experiences, authentic work experiences, and not kind of like in school kind of activities, but you actually are moving out into the community and looking at what a job means and is, the more experiences like that kids have and young adults have as they move into the work world, the more successful they're going to be at actually having a job. So really impressing upon schools and families and county boards and providers that actual experiences, more than just being in a building and doing the activity, but being in the world, in the community, and actually doing it, you're going to get a better result from that endeavor. And so this intention of that transition framework was reducing duplication of efforts, saving time by co-planning and co-implementing assessments, having a better understanding of how partner systems work by building relationships, and saving resources by coordinating efforts. So again, agency neutral, cross-agency planning. And then the players are youth, family, educators, that Opportunities for Ohio as a Disability Agency, that Vocational Rehabilitation State Agency, county boards, and Ohio Means Jobs, OMJ, and then workforce, WIOA, all those kind of combined in mental health. All these organizations and agencies come together to help plan for the future. And this slide kind of plots out the differences between old school and new school ways of thinking. Agency by agency planning. If it was agency specific, each agency works in its own structure and its own silo. Each agency offers activities and services based on procedures that are typical to that agency. In an agency neutral concept, all work together to contribute to a single comprehensive plan and outcome that benefits all the agencies and is owned by the youth and the family. So that's the new way of thinking. That's a new way of doing it. Service focus. Success is measured by each agency's service standards, accountability requirements, and benchmarks. So it's basically about how much service somebody gets. Looking at it through an outcome-focused lens, it's each step of the collaborative transition plan brings the youth closer to that outcome of a meaningful adult life. Focus is on how effective the services are based on that outcome, as opposed to just delivering the service is the outcome. And then if it's program-centered, on the left here, the conditions created by agency-specific and service-focused practices limit planning to discussing participation in a completion of programming, as opposed to, if it's person-centered, efforts begin and end on what is important to the individual, and then using that importance to drive the way the services are delivered so that you have an outcome, which might be a job, might be community membership, might mean education. It just means a lot of things specific to each person we're supporting. So basically, in a nutshell, transition planning, and really planning for anybody, is where are they going, where are they today, and then how are you going to get there? So basically, we need to think of these three questions as we move into any form of planning, but especially around the transition from school to adult life. And that means start where you want to end. That means looking at having a vision of where you want to go, and then backing into this idea of like, okay, what is it going to take for me to get there? So backwards planning, what I'm getting at, is represents the planning done by multi-agency teams. Opportunity to discuss the graduation date, provides a basis for data and commitments for services to be incorporated, includes important details not appropriate to official agency documents, it merges all the information and service from multiple agencies onto one page, and then it also informs and brings congruence among multiple documents. In this world of systems that people with disabilities and students with disabilities live in, there's like I was going at it, the county board, there's Ohio opportunities for Ohioans with disabilities, there's the school system. All these agencies are coming at you to support you, but they have different plans, different paperwork, different ways of doing business, and it can often get confusing. So this idea of backwards planning and this framework kind of allows you to kind of pop out of that kind of noise and just kind of get in your head, this is the direction I want to take, and this is where I want to be when I graduate. What supports do I need to get there, as opposed to just kind of going along and following the services. You're kind of leading with this vision of what you want to accomplish, what you want to make happen. So that process, like I'm talking about, provides a map that's easily understood by youth, families, professionals, and incorporates input from everybody, youth and family. It's a communication tool, and it's an informal document that you can change, modify, update. This is our Employment First web page, and everything I just talked about around transition planning, around Employment First, you can go there at this link and kind of walk yourself through transition planning, around supporting providers. There's a great job seekers guide for people with disabilities to learn about all the stuff I just told you about. So basically, this is the go-to place for all things community integration and employment. So I think I've talked through everything I can think of around community integration and community employment. If you have other questions or concerns, you can always give me a call or email. And thanks.